yourself. Don't do that. Oh, he does it again on the other side. Oh my gosh. I've always said it a million times. Do not pull an impaled object out because you can cause more damage. Now, he's in the middle of the wilderness and he may have to do that. You want to actually get to help to get the bleeding to stop. That way you can salvage the rest of the limb. Oh, he's on fire. He's patting it out, which is fantastic. If the blister is not opened, it's protecting, it's sterile. It's when those wounds open up, you want to use an ointment.
You want to borrow my ointment?
Keep the wound clean. People think to dry it out, you actually want to keep it moisturized. Oh, nice, perfect. He was able to use a type of dressing. It could be a dressing that's impregnated with like an antimicrobial type substance, or it could just be to protect the area so you don't get schmutz and dirt into the area. Oh, no! The way that it's hanging there, it's definitely double bones. That means the radius as well as the ulna are fractured. He resets it, which we actually do in the emergency department. But typically after you reset it, you need to put a splint on it because it's still floppy. It's not attached anymore. Oh, nice. The way that it's sounding and crunching, it's probably broken. Once the joint is out of place, all the muscles spasm and keep it held in that bad position. So if you can actually get the muscles to relax, you can pop it in pretty easily. Oh, ow, no. How do you get a nail in between your tissue here? Depending on where it is, it's probably fine. It's probably going in between your metacarpals and it's just a soft tissue injury. But you always worry about tetanus, so you have to make sure your tetanus shot is up to date. Oh, rebar to the abdomen. Again,
Pull out game weak.
if you hit the intestine, you pull that out, now you have flying out in the abdomen, you become septic. And if it goes untreated for too long, you're gonna die. Oh! Snake bite. You have to get crowfab if you get bit by one of these snakes to counteract its effects. There are multiple different venomous snakes out there. Just know which ones in the area that you live to be aware of. Oh, nice. Just using like good bandage. You always have to worry putting on a bandage. You want to make sure it's not too tight because you can actually decrease blood supply. Your hand turns purple, white, blue, and tingly and numb. If that occurs, take that off and rewrap it. What is that? Oh my gosh. There's only a few instances where you actually go after the bullet and take it out. Most of the time you just leave it in. The risk of causing damage to the tissue is greater than in that moment of potential poisoning. Oh man, maybe the bullet's causing pain. If it is that superficial, you can take the bullet out. You're using dirty things to get it out, so you have to worry about wound infection. Bullet wounds themselves, because they're so high pressure and so much heat, most likely not going to cause an infection. Falling. Oh my gosh. Here he's got a floppy wrist, potentially fractured the distal ulna, distal radius. If it goes into the joint, you always run the risk of having chronic arthritis, so really need to be careful. Oh my gosh, you have to worry about the different microbes that are actually in the ocean water. At least get it cleaned out and then watch it. And then if you start seeing erythema or redness to the wound starting to creep up, get to the hospital. You probably need certain different types of antibiotics. Oh! Wow! The hand itself is so vascularized. There's a lot of special nerves in there. It can cause a lot of damage. You just have to be really careful because once you injure these type of distal nerves, you're probably not going to get them back because they're so small and you can't really fix them. They're just tiny little strings. Oh, he is just so shot up that he's just taking out all the bullets that he can get. Nice. Bullets don't just hit the tissue and typically stop. Usually they go through the tissue and cause damage on the routes that they take. A lot of times we see bullets that just go through and through. Nice. When in doubt, throw a good wound dressing on there. Sometimes we use a dressing like this that might be impregnated with an antibiotic ointment, so to speak. Oh no! Will that hurt like a son of a? Yes. Can you actually do that? Yeah, you can. In the hospital, we do something similar. We have a Bowie knife. It heats up so it can actually cauterize small blood vessels. All right. Oh, you know what gets me with these is the sound. It doesn't make that kind of noise. Is he using his own teeth to pull that out? Oh my gosh. Every time he fixes himself, he's like, you don't want to move it. It's going to hurt like hell. Uh-oh. Driving a truck or an SUV. Oh, he's popping pills. It could be related to ibuprofen, could be antibiotics, could be pain medications. Oh yes, the famous good duct tape. You can use duct tape for anything. Covers wounds, you can take out splinters with it. You can even treat plantar warts because it takes a little bit of the skin off every time. So you put it on, take it off, put it on, take it off. What happened? Oh man, oh. That is gnarly. Are you gonna bleed out and die from your hand? Probably not. In this situation, probably just fine to pull it out, but you definitely need to do a pressure dressing to that area. The cigar is probably just hanging out in his mouth because he's walking around holding his pistol with 2 hands. You're giving up your position by having smoke around you, but at least you're able to use it to then cauterize your wound. Oh, nice. In a lot of these depictions, you don't have the amount of swelling that you would have, even instantaneously. It's good that he's actually relocating them quickly because the more swelling that you actually end up having, it's harder to get it back in the joint. Oh, the fingers. I have seen so many x-rays where the fingers like almost like 90 degrees. Very easy to put back in, almost like you want to like pop your own joint. Does it hurt? Yes, of course, but it feels so much better once it's back in. That's pretty cool. So I wonder if he's using the duct tape as a way to defend himself against the wolves there. Maybe this way it protects you a little bit against the bite. Obviously, teeth can penetrate through that, but maybe it gives yourself a little bit more time to defend yourself. Walking through a swampy area back in Vietnam and stuff like that, they always ran the risk of having something called trench foot, where their socks and their boots were always wet. You always increase the risk of gangrene, wound infections, things that won't heal because you have tissue breakdown. Oh man, rusty metal. I bet this guy's had so many vaccinations. Probably gets a tetanus shot every year. Oh, straight through. If you hit into the bone, one, it's gonna be harder to get out. And then you really worry about something called osteomyelitis, which is an infection of the bone. If somebody gets that, typically it's 6 to 8 weeks of antibiotics. Think about that. Nice. Forearm injury, we're wrapping it with duct tape. Duct tape is used for like everything under the sun. For a potential wound dressing in an emergency, it is good. Getting it off is gonna hurt a lot, but you're in a situation where you need immediate closure of a wound, get something to stop bleeding or protection. I think that's fine. The glue on the duct tape is so good and so strong that they actually tell people they can heal plantar warts by putting duct tape on and pulling it off. Classic, popping some pills. White and blue capsules. Patients will come into the emergency department all the time and say, oh, I take the blue pill, or I take the red pill, or I take the one that looks like this. They're all different colors, shapes, and sizes, even for the same pill. They have really good apps that we have on our phones where you can look up the color, the shape, and then sometimes on these capsules or tablets, they'll actually have a number or a letter, and you can input it and you can actually figure out what the pill is. Oh, nice. The noise. Actually, sometimes it makes a pop noise. Sometimes the only noise is the person screaming. No, I'm just kidding. Typically, what we'll end up doing is not just grab and pull without any anesthesia. Sometimes a patient wants a pill to help with the pain, but a pill is going to take like a half hour, 45 minutes to an hour to get in your system. Oh, but it doesn't make that kind of noise. Typically, a shoulder dislocation that we put back in might make a clunk noise, and same with the femur putting back in place if you have a hip dislocation. Oh, we got a limp wrist. When somebody comes in with a wrist this way, I'm not thinking that it is fractured or broken or dislocated. I'm thinking like the nerve doesn't work anymore, that there's another type of injury. Kids will come into the ER with their arms like this, and it's called a nursemaid's elbow. What the treatment ends up being is just to turn it over and flex it back up. Let's see. Oh man, snap, crackle, pop. We're probably going to get an x-ray of it in the emergency department because we have time and we want to make sure that there's no fracture and we want to make sure that we don't cause a fracture. If there's a fragmented piece of bone in the joint space and you try to do conscious sedation and you try to then put the dislocation back together, you have a bone in the way and nothing's going to work. So then you just sedated the individual for no reason.
No reason!
Oh, this, let me just take out a cigar. The wound is open, bleeding, and you can't get the bleeding to stop. You're in an area where you don't have bandages. Maybe you can burn this. In the emergency department, the only time we do use heat or cauterization is typically if we're doing something called a trephination. Somebody has blood underneath a fingernail that causes a lot of pain and pressure. So you can actually just pop a small hole through the fingernail. You burn a little hole straight through it and the blood releases. The pressure feels much better. Why would you have alcohol in the game? Maybe for pain. When that alcohol wears off, you got the headache from a withdrawal, you might feel nauseous and vomit. If you do enjoy the occasional drink, but you want to try to prevent the bad day the next day, check out Poor Decisions by Life Happens. Oh. Whoa. Small impaled object. You guys always know I say please don't pull it out, but in this circumstance you probably need to pull it out because you don't have anywhere to go to get medical care. When you pull something out that's been impaled, you have an increased risk of a major bleeding episode. But these are forearms. The likelihood of major bleeding that can't be controlled is low. Worst case scenario, you need to use a tourniquet to get the bleeding to stop. Oh. These impaled objects, they look pretty jagged. Are they metal versus like wood? Could they leave splinters in there? Maybe. Splinters eventually make themselves pushed out of the body. They eventually get out. But again, increased risk of infection. And now you have open wounds. So make sure you put bandages on this. Most of the time I tell patients to put antibiotic ointment on top of these. The ointment itself will help heal the wound. And then obviously the antibiotic component to help prevent infection. Oh man. Ouch. Palmar surface probably between the bones because it wouldn't come out so easy when a nail, kind of a nail, it's like a sharp metal object, is punctured through bone. It actually sticks pretty good. It takes a lot of effort to get it out of there versus the soft tissue. Now you have nerves that run down in that area. You also have a lot of muscles. It just causes a lot of pain. Oh, right through the palm. Puncture wounds increase the risk of getting infected. Making sure your tetanus shot is up to date is important. And then good wound care. If somebody has a bad puncture wound, we'll actually clean it out really well, but then you can't really close the wounds up because you want it to drain out, because if you seal that wound because it's a puncture wound, you have an increased risk of it becoming infected. And especially the hands where it's so far from the core, if you get infected, it takes a lot longer for it to heal versus if something is more towards the center area of your body. Oh my gosh. My favorite. Come on. Come on. We're using pliers to pull out bullets. Get the bullet out, you save the life. No. The bullet, majority of the time, isn't superficial where you can just grab it out. Obviously, if it is just simply superficial, yes. But it's typically buried within the tissue, deep in the body. And most of the time, if it's not easily accessible, it is actually left in the body. People always ask is, what about lead poisoning? That's why I tell people to avoid getting shot. And then second, you potentially can go see a plastic surgeon or a specialist to look in that area and see if it would be advisable to have it removed. Oh, looks like vomit. Oh my gosh. So everybody's vomit is pretty much a few shades of a very similar color. A brown, a clear, a yellow, a green. If you're seeing black, if you're seeing like bright red, that's very worrisome that you're having bleeding or digested blood. Oh, massive syringe, futuristic or barbaric. I can't make the difference. You got tubes and this massive needle that is pretty blunt tipped, if I have to say. It should never happen that way. Yes, we do IM injections, but we're using smaller needles and we're more gentle about it. You're direct into the bigger muscles. No. People get bitten by these type of reptiles and they lose limbs. They're very jagged. If you get the limb back, really hard to put back together. If you were to lose a limb, remember, hold pressure. If you can't control the bleeding, use a tourniquet. Whoa! Oh, shark-infested water. They're black-tip sharks. I actually swam with black-tip sharks. They're not that big, but they're like, holy crap, I am surrounded by sharks. Oh my gosh, it's got its thigh leg. Look at this, oh my gosh. Hard to tell, most likely the shark has got a hold of the upper thigh. How could you succumb to the injury if you haven't taken the leg? If you hit the femoral artery, which is right in the inguinal ligament, right at the crease of your groin, that's where a very superficial area where your femoral artery would be. And if you get that lacerated open, it's a pretty big vessel. You could bleed out pretty fast, not super fast, but pretty fast. Oh my gosh, some big piece of wood pulling right out of the forearm. Are there major blood vessels that you're going to injure yourself with if you pull them out? Yeah, there are some actually. Now you can fix it. You can put a tourniquet around it. You can push pressure on it. You would just have to know that risk of what's happened. Oh man, so modern day arrows, you try to pull it out, it actually gets stuck. Sometimes the better thing to do is to push it all the way through or cut that end off and then pull the rest out the other direction. Now this game is like forever in the past.
Quit living in the past.
It's probably just more of like a blunt tip, but they still have the wings on it, so to speak. So you can see on the second arrow that he pulls out the one end, snaps it off, and then pulls the other end out, exactly as I just described. Even in this situation, you can still wrap it to prevent the bleeding. Oh my gosh, just the sound. It gets stuck in the bone. It's actually stuck in the bone.
It's in the bone. It's in the bone.
Hard to get it out. It may need to be just snapped off and leave it as is, especially in a situation where this individual is running around in the wilderness. Oh, he's on fire. Stop, drop, and roll. There you go. We finally... Stop, drop, and roll. It's the first thing that comes to my mind. Patting it out, you can do that, but you're potentially going to burn the palm of your hand. And then the other thing obvious would be to take off whatever is burning, such as the clothing. Oh, we get people who dislocate fingers very often. Normally it occurs at the PIP joint, which is the proximal interphalangeal joint. To put it back in, you actually pull a little bit so you can disarticulate where it's stuck and then pop it right back over. Oh, I'm like, what is he swinging at? But it is a bee. I hope he doesn't have an allergy to bees. If you have an allergic reaction to the bee, we're gonna give you epinephrine. Obviously in this setting, that ain't happening, so don't piss off the bee. Bees are really good. They help with pollination. They help with the environment. Try not to kill bees if you don't have to. Oh my gosh. This is like a major onslaught of arrows to the forearms. Prehistoric time, there have some probably medicinal things out there. Would I pull these out in these situations? Yes. What else are you going to do? You're in the woods. You're potentially going to die. You also increase the risk of having infection and dying from that, but you have to weigh the risks and the benefits. Oh, sweet. Wait a minute. Oh. I don't know how that guy got burned.
How'd it get burned? How'd it get burned?
If you have that many flames around you, the flames are taking the oxygen away from you. So you're going to have difficulty breathing. You're freaking out in pain. You're going to be breathing heavily, which then you're going to be breathing in the flames, which is going to increase the amount of inflammation. And then you're potentially going to cut off your own airway as well. Oh man, he threw a ton of bees at him. We'll have people that come in who aren't allergic to bee stings, but because of the amount of bees that actually got them,
I'm covered in bees.
it causes just a massive inflammatory reaction. We've had people where the pain is so bad that we'll literally intubate them, sedate them, just knock them out so they don't have to suffer through this pain while their body is trying to defend itself, so to speak. Oh yeah, sweet. So I love it. I love it. Okay, finally I'm seeing this. He's actually putting things on his wounds to make sure that they don't get infected. Super cool. Plants are amazing. There's a lot of plants out there that actually do have the ability to help decrease inflammation, fight off infections. Some of the medicines that we have today are derivatives off of plants that were used way back when.
We are the flower children.
Oh, it's like getting soothed by his wound healing. Even the military does this if they don't have wound dressings, is to pack the wound filled with dirt. Obviously, it increases your risk of infection, but it's going to stop you from bleeding out and dying. Oh, we got a boar. Get the boar. Is that a boar? No, it's a lion.
Lions and tigers and bears.
Oh my!
It's getting slashed up. It looks like probably a female lion.
I'm a lion!
Don't mess with big cats. The bite wounds are going to potentially cause infection, and same with the scratches from the nails. There are 2 bacteria that we worry about relating to cats, Bartonella henslii and then Pastorella. We have specific antibiotics against, but not them. They're using all these arrows. The question is, were they poisoning the tips of their arrows with a dart frog? It messes with your nervous system and it's very, very toxic to humans. Do they just put their arrows in your fecal material? That way you do get infection when it actually hits. Is that something that they knew of back then? I don't think he needs to rip it out in that setting unless it paralyzes the arm or incapacitates the arm that he can't use it. So in this case, don't pull it out. Ooh. On the top side, this would be your dorsal aspect. Most of your blood vessels are actually on the underside. They're protected. So where he had the wounds, it was just stuck in the tissue. You're just gonna have normal bleeding. You're protected by the bones with the arteries at your wrists. Oh my gosh. You should be wrapping them up. Obviously, you're wearing clothes, so you should potentially even just take a piece of your garment and wrap it around it. To stop bleeding wounds, you need to put pressure. A lot of us just put bandages on them and don't put pressure on them. They're going to continue to ooze or bleed through. Wow, super cool. Really cool that they're actually putting stuff in the wound. Obviously, we don't put things in the wound very often, especially if it's an open wound and it's healing because you can't close it right away for whatever reason. Even using the stick in the mouth to bite down for pain, people still do this. Grit your teeth, so to speak. Even when I work out, sometimes I wear a mouth guard because I'm gritting down to lift something really heavy. Super painful. It's like pushing really hard in there. A lot of times when people come in for wounds, we'll numb it up with lidocaine first. And the pain from getting injection is actually the medicine itself. The acidity of the medicine will actually cause it to burn and feel uncomfortable. The needle itself is so small and the wound is already cut. You have already injured the nerves that typically the needle doesn't hurt. It's actually the medication that actually hurts. Tough. Cool, and now you're going to put a leaf to cover it up, right? Nice. Then yes, you're going to cover the wound. You may put antibiotic ointment in there. There are different leaves out there that do have some anti-inflammatory and medicinal uses. You want to make sure that you know what plant or leaf that you're actually putting on your wound, because there are some good ones and there are some that are toxic and actually cause more harm and cause infection. So you really need to know what you're using out there. Oh, what is it pouring on that? Wait, it's, oh, holy cow! This is in a video game? We don't have anything in the emergency department that you can actually pour on to re-stick things back together. We have Dermabond, which is like a wound adhesive, but then to reattach a limb, you gotta reattach the blood vessels, you gotta reattach the nerves that they can find them, all the musculature, tendons, attachments. Nice. Oh! Oh! Of this laceration, you always worry about how deep it goes. Does it just go through the skin? Does it go through the subcutaneous fat? Then does it go into the muscle? We look to explore these things to see if we need to do multi-layer closures. You got to put the fascia back together. You got to put your muscles back together.
We can rebuild him. We have the technology.
Oh, right through the hand! Straight through the hand. You always worry about fractures. You have to worry about both sides sewing that up. You may not want to fully close it because you'll lock in any germs that are already there, even though you wash it out really well. Sometimes it needs to go to the operating room to get cleaned out, washed out, placed on antibiotics. Oh! What? Are you kidding me? A shovel to chop off the leg? Even when it's separated like that, you actually still believe you kind of have the leg there. It's called phantom limb syndrome. Oh, that's just messed up. What is that? Strong first aid medicine. If he's bleeding out, sometimes there's a medication that we use, TXA, the medicine that helps decrease bleeding. Oh my gosh, okay, perfect. We see the leg with the missing limb. This is an indication for a tourniquet. If you put the tourniquet on above the knee, you increase the risk of tissue breakdown and ischemia to anything distal. Distal meaning further down the road. If you do it just below, then you're just taking care of that section and stopping the bleeding. Oh, it's the magic medicine. I wonder how strong of a connection that binds to it. Somebody will ask, how long does it take for it to heal? You take the stitches out in, say, 7 to 10 days. But that thing is going to heal and form scar tissue over a long period of time, even up to 6 months, even to a year. What's she doing? Oh, screwdriver! When I said many times in the past, don't pull it out, in this situation, you have to. You can actually hold direct pressure if you're having a significant amount of bleeding. In this situation, pull it out and then use it against that individual zombie woman. There it is!
Now,
Do it!
let's see how you feel.
Go! Come on! Oh man, the twisting! Don't try to twist that. That's gonna hurt so bad. Yank it! Come on! You can actually even use your other hand together to pull it out and then pull it off because it's probably stuck in the wood or whatever it's attached to on that other end. Yes! He's getting it out! Yes! Oh, wow. Just destroying him. Blood smatter on the screen. It's never a good sign. Oh! Getting bit. Run away. Let's see what the hand looks like. Damn. They did a really good job of showing anatomy to make it look real. But in that situation, hold the direct pressure, put a dressing around it, see if it stops. Some friends of mine who are in the military said they were even told just to throw dirt in there just to stop the wound. In this situation, oh, he's got an arrow through his thigh. Besides going through the soft tissue, did it go directly into the femur? And if that arrowhead's like stuck in the femur, it's gonna be really hard to pull out. Not so bad. If this happens to you walking down the street and you randomly get shot by an arrow, don't pull it out. You can snip it so it's not just this big thing just sticking out and get to the hospital. Nice. Nothing like a good staple gun. We use a staple gun all the time in the emergency department. It's actually quite useful in scalp lacerations, large lacerations anywhere in the body. It actually grabs the tissue and pulls it together. Oh, nice barbed wire. That's never good. Tetanus doesn't just form on rusty things, so to speak. We always worry about it when it's related to dirty wounds in general. When's the last time you got a tetanus shot? Was it within the last 5 to 10 years? If it's definitely greater than 10 years, we're gonna give you an updated TDAP is what we call it. Oh man, look at that. That is amazing. You can see the bone sticking out of the top. That needs to be rongered down or broken off and the tissue wrapped around it, and it's just gonna be a stump. It's wrapping it. Nice work. All right, that's pretty good. The way that it's wrapped is how we would do it. You typically probably wrap it a little bit further down the wrist if you had enough of the gauze or the Curlix, whatever type of material that you're using. Oh, man. Could you rip through it this direction? Yeah, you probably could if you had enough force and the object was sharp enough to go through there. But you really have to pull. Our tissue is very elastic, so it may not rip as easy as you'd want it to in this situation. Wow, he's being hung up. And yeah, perfect. You can see ripped right through it. You got the metacarpals here that turn into your phalanx of your fingers. Split right down the middle. Oh! Awesome! The anatomy looks pretty good. Major arteries run with major veins as well as the nerve. Not every single vessel in the body that way, but majority of them. Oh, it's so good. The blood splatter. I love it. It's like crazy. No, it would go. You're going to have arterial bleeding and venous bleeding. So your artery blood is going to be bright red because it's oxygenated blood. And the venous blood is going to be a little bit darker. Okay. Who the heck is that? That amount of force to break through flooring, even if it's really thin flooring, is a lot of force. If you fracture your sternum, fracture your first rib, or your scapula, that tells us there was so much force to the thoracic cavity that you have to really worry about internal organ injuries and damage. Run away! Run! Oh, he's just coming at her. Oh! We're in a flaming building. You have to worry about, one, decreased oxygen and smoke inhalation, and then it's producing all this smoke. A lot of times fires in industrial buildings, homes, they're burning other toxic chemicals. So you increase your risk of having you know, cyanide poisoning.
Oh, I like the injection. What is he injecting to himself? Most likely either pain medication, probably like morphine. It's an auto injector, pushing the button and it injects in. Something similar that we have, epinephrine. If somebody has the EpiPen, it's an auto injector. Some people who are diabetic,
Diabetes.
sometimes have almost like an auto injector like this for insulin, where they can put the dose on the outside, calculate it, and then they can inject it in. Oh man, that was a huge shot. Definitely got shot, injured, because I see on the upper left that there's a change of color to the left arm. So I wonder if he got shot and needs to be healed. What can you give yourself that could actually heal that fast? Nothing really. Your choices are basically pain medication, adrenaline, maybe a topical or an injectable anesthetic like lidocaine, just to help with the discomfort. Could be ibuprofen, could be Tylenol. Walking around. Typically, if you're going to do an IM injection, you want to go into a big area, big muscle. That's why at the hospital, we typically use the shoulder or the deltoid, or we'll use your buttocks or the big glute.
Maybe just one glute?
It's also an area where there's a lesser chance that you're going to hit a vessel, because the whole idea is you're going to inject these intramuscularly, not intravenously, and you don't want to hit a blood vessel because then the doses are different. Oh, we got a meg bag. Trauma shears, really cool. One of the blades basically has a little lip on it to help get underneath stuff. Oh, I don't know what he just took out there. It looks almost like a type of forceps, like a ring forceps or Kelly clamps, so you can actually grab something. They are ring forceps, actually. On the end, they're circular, so you can grab things easily. That's what that's for. You can also clamp things down.
The clamps!
Oh, we got a screen with some blood. Shot to the chest, possibly. Here we have a syringe, because you can see the plunger on the top. Trying maybe to show that we're doing it intravenously versus IM, but through the clothes. Typically, we tell people to do the auto injectors. If you're giving IM, clean off the surface. Whatever's on your skin is going to get inoculated into your tissue, which increases the risk of infection. Cool weapons. Oh, we got some bandages. Okay, so sometimes we call these like curlics. Typically, if you're gonna wrap a wound, put some more heavy gauze in the area, then wrap it so it stays in place, compress the area. Sometimes what you can do is actually split it in half at the end, and that way you can actually tie it into a knot around the area. That way, if you don't have tape, you can do it that way. Oh, we got a bottle of pills. Just carrying a bottle of pills in my pants.
A bottle of pills.
Purple label. Can't really make out what the lettering says, but really cool, very interesting. You're trying to open the bottle and you can't, because you gotta like push it down, push pressure, and then turn it. One big pill like that. I know people out there probably have had prescriptions for 600 or 800 milligrams of ibuprofen. They look like that. Antibiotics look like that as well. Could be pretty much anything. If anybody knows, let me know in the comments. Speaking of pills in the pocket, I don't know if you guys know or not, I launched a supplement company called Life Happens. These are not just your everyday vitamins that you've seen on the shelves. These are as needed when life gets you, researched and studied ingredients. So definitely check it out. Oh, we got another med kit. I actually have a med kit that I travel with, even though it's just civilian travel. I want to make sure that I have like sutures and a needle driver just in case. I have some numbing medicine. I got a lot of bandages. Oh, what is this? We got some like salve. We got some balm.
Who told you to put the balm on?
Is that used for the lips? Is that used for the skin? Really good for hydration. Even if you're getting like windburn, it's good. You don't want to have like cracked bleeding lips. You don't want to have like cracked uncomfortable skin. So you definitely would use something like that. Or is it used to like clean your weapon or moisturize your gloves? You know, that's another thing that people do with this stuff. Oh, there we go. Is this like a A meal, there we go, an MRE, right? MRE stands for Meals Ready to Eat.
Mr. E.
I think you do have to do some heating maybe to it, put it out in the sun. Tell me if you ever eaten one of these. Really cool that it's in the game. In the emergency department, people are always asking about food. I mean, it's not the best. We got graham crackers, we got turkey sandwiches. Turkey sandwiches are very specific. It's actually been studied. We specifically have them for people who might be hypoglycemic.
I'm hypoglycemic.
It actually helps with the blood sugar the best, as well as juice. Really cool, that white piece right there is a type of staple gun. Sometimes they're that big. Those are so much easier to use. Then we have really little ones. In the emergency department, we typically will use on the scalp and maybe some big, massive areas. But most of the time, if it's anywhere else, we'll actually suture it with just simple interrupted stitches. So cut off the clothes. Is that supposed to use the tool to pull out the bullet? That's hilarious. We don't go digging for bullets. We do not take them out. If it's just superficial where it's so easy to like grab it and like pop it out like a pimple, no problem. But other than that, if it's deep buried into the tissue, it's left there. Causes a lot more devastation to the tissue as you try to get it out. Oh, cool. I like this med kit. What's this? Oh, we got some bandages wrapping around the arm. Very cool. That almost looked like 1-inch tape going around. Could be wrapping something. Different types of bandages that actually are impregnated. Yes, I said that word, impregnated, with different ointments and antimicrobial things to prevent infections. Oh. We got a needle popping off. I love the technique of like flipping it off. At the hospital, we don't do that because somebody's got to pick it up and I'm not going to make somebody else pick up my trash. We deal with a lot of people, unfortunately, that use IV drugs illegally and they inject and they miss the vein and they inject into the subcutaneous tissue, into the muscle, and then cause bad abscesses and infections. Oh, this is a sweet bandage. That was actually a huge bandage that probably has some sort of special medicinal properties in it. If you're bleeding, cover it up. A lot of pressure. What we're not seeing in this video game is the fact that you're not putting pressure directly onto the wound. You're just wrapping it and covering up, quick injections. I mean, it's fine. It's for the speed of the game. It would be cool to be shown, hey, you push pressure on it. Looking at the image, we got arm problems and abdomen problems. All right, wrap the arm. Oh, that looks like a type of tourniquet. Probably not tight enough. I carry a tourniquet in my car as well as in the house, just in case. The classic one, it's the cat, and it's basically a tourniquet that Velcros onto itself, and then it actually has the ability to twist, so then you can actually make it super tight, and then it will lock in place. And then you actually want to write on it, there's a place for it, of when you actually put it on. We just like to know how long a tourniquet has been on there. Oh, just hearing the crunch, the sound that we sometimes hear at the hospital when we're putting bones back together, is actually pretty accurate.
Snake, you've got a broken bone. You'll suffer broken bones if you jump from too high a place or get hit with a severe blow.
That's pretty cool. This is actually pretty cool information.
I'm learning a lot from you right now.
Oh, what is this? Non-displaced rib fractures. You don't really want to put a bandage on rib fractures if there's no wound on the outside, because then it's going to prevent you from expanding your lungs. It increases the risk of developing pneumonia because you're splinting, not allowing normal airflow in and out of the lungs. What do we got here? Oh, we got a forearm injury.
Your arm is broken, you have a broken arm.
You got two bones of the forearm, your ulna and your radius. If your arm is in that position, that is your radius. There's something called the annular ligament where the head of the radius is, and it allows us to rotate like this. That's why we're able to rotate the forearm. What are we doing? Oh, trying to reset either a bone or a dislocated joint. From an elbow standpoint, most commonly you're going to have a posterior dislocation of your olecranon or the ulna, basically going backwards. Really not easy to just pull it and put it back into place.
That's a nasty cut you've got there. To treat a cut, you need disinfectant, styptic, sutures, and a bandage.
Disinfect the wound, yeah, so clean the wound. Styptic, which is basically a vasoconstrictor to stop any active bleeding, sew it up, and bandage. So we don't do the styptic unless we want to anesthetize the area and we inject lidocaine with epinephrine. The epinephrine causes vasoconstriction to slow down the bleeding, actually. Oh, wow. Sewing up the wound. We got Rambo style, sewing up the wound without any anesthesia.
Rambo style.
It's a little crude. We're biting off the thread. When you're actually suturing a wound closed, it's a clean procedure. It's not necessarily a sterile procedure. Blast injury. Whoa, on fire.
Snake, you've got a bad burn.
That is a very bad burn. Probably going to be full thickness, 3rd degree burn. Even the airway is going to probably have some injuries to it. Doesn't realistically portray what a burn will do to your body here. Oh. Holy cow. These are not survivable injuries. Come on.
Come on!
People will get multiple gunshot wounds and will survive, or somebody has gotten 1 gunshot wound and passed away. We're going to first do our resuscitation. Airway, breathing, circulation. Then we're going to look specifically at the holes. Get imaging, see if you need to take the person to the operating room to fix underlying structures that have been destroyed because of the path of the bullet.
To treat a gunshot wound, you need to dig out the bullet with your knife, disinfect the wound, and apply styptic, and wrap it in a bandage.
If the bullet is close to the surface and you can literally feel it right there, fine, you can try to get it out. But in general, digging around with a knife is going to cause more damage. Areas of the body that we do want to get the bullets out of would be joints, maybe brain, and probably the spinal cord. But everywhere else, if it's in your soft tissue, it's left.
Snake, look at your body.
Yep, looking good.
Not there.
Then where?
See the leeches?
Oh, cool. Leeches, when they bite, they actually produce an anticoagulant so they can prevent your blood from clotting where the hole is that they're sucking out of, basically. What are all these leeches just buried in? That's so funny. Sometimes in medicine, they'll actually use leeches. A couple of different reasons, depending on where you are in the world. Sometimes for bloodletting, other times for trying to actually draw blood to a certain area. Smoke that cigar. Oh my gosh. What a waste of a good cigar. Don't smoke cigars. Increases your risk for mouth cancer. Oh, so you have your cigar to burn them off? Come on.
Come on!
Oh, is that crossbows? What do I always say? Don't pull it out. Say it's in your bone or your muscle you're trying to contract and it's preventing that from happening. But these have barbs on the end of them, making it very difficult for you to pull them out. They're pretty much stuck. Yep.
That vault is coated in the venom of the Brazilian wandering spider.
Brazilian wandering spider, one of the most venomous spiders in the world. It causes significant amount of pain, sweating. It can even cause priapism, the sustained, unwanted, non-sexual aroused erections.
You can get serum by capturing the rabbits that live in that area. The rabbits in that area have antibodies that protect them against the venom of the Brazilian wandering spider.
Anti-venom is basically from serum of different animals that have been able to produce the antibodies against the venom. Here in the United States, the anti-venom that we have is basically against certain snakes. We have 2 different types of anti-venom, one made via horse and the other made via goat.
It'll all be goat.
Then disinfect the wound and apply styptic to stop the flow of blood. Once that's all done, the arrow wound should heal right up.
These are not just gonna heal right up. We have penetrated trauma to the thoracic cavity, likely punctured the lung, probably causing a hemopneumothorax. There's a potential that it actually hit the heart. Oi! On the lower extremity there, just medial to the femur, there's a chance that you can hit the femoral artery, just depending on your body of where it crosses. Even in the one in the neck. The one in the neck, you can't tell if it's going through the spine or not. Oof.
Snake, your right eye.
Trauma to the right eye. You can get traumatic iritis. You can cause a laceration around the eye. You can actually rupture the eye called a globe rupture where the fluid of the eye starts coming out. You can also cause any type of fracture around the eye socket.
The cornea and the lens are severely damaged and the eyeball is ruptured.
There we go.
There you are!
The cornea are the cells that are covering the color part of our eye. Very sensitive. The lens is behind the color part of our eye and allows light and images to be reflected onto the retina in the back. Cool. Auto injectors, preloaded syringe on the inside. Sometimes these are single use versus multiple use, meaning the epinephrine that we have for an EpiPen is a one-time dose versus an insulin pen, multiple different amounts of medicine in there so they can give it to themselves multiple times. In the game, you're getting shot in your forearm. Most of the time when you're giving these type of injections, you're either going sub-Q or IM, you're not going intravenously. Say you're diabetic and you need insulin, a lot of times you're doing subcutaneous on an angle of the abdominal wall into that tissue. Could be pain medication, could be stimulants, energy boosts like epinephrine. It also could be related to wound healing. We have like peptides nowadays out there, maybe something similar to that. Really cool concept and actually really nice graphics. Oh, cool. All right, we got some splints. Actually, that is so good. Those look like the brands I see when patients come in from EMS. They can be molded, either have a wrist injury or a forearm injury, unlike the elbow. When somebody comes to the hospital, if the EMS put them on well, we'll actually leave them in place. We'll just double check to make sure the patient has sensation distally and a good pulse. Oh, we got a tourniquet going on. Trying to save somebody's life by slowing down all the bleeding. That's the whole point. At the antecubital fossa, basically in the elbow. Maybe necessary, maybe not. You could probably just use the bandage. Different types of tourniquets. Very cool.
Very cool stuff.
There's a mechanism to where you can actually twist it to get it even tighter. You want to actually document when you put it on so we know how long it's been on there. If you have to leave it on for days, you know that the distal end of this tourniquet is going to die. But if you're trying to save somebody's life, that's a different story. Yeah, so this third tourniquet is the one that I actually carry around in my car, called a CAT, a combat application tourniquet. It has a really nice bar that actually you spin, and it does hurt a lot when somebody puts it on really, really tight, but you're actually confirming that it's working.
That means it's working.
Oh, we got a bag. I have many of these type of kits in my house. We have tweezers, we have some either scissors or Kelly clamps, and then another device that's probably for either gauze or a blade. All right, so these are another clamps here. It looks like you just pull the bullet out. Typically, it's not life-saving to remove a bullet. If it's in your brain, if it's in your spinal cord, if it's in a joint, maybe. But majority of the time, it's in soft tissue, it's broke through bone. In my experience, majority of the time, the bullet stays in. Oh, very cool. That is a big curved suture needle, which actually we use. The reason why you have such a big arc like that, looks like a crescent moon. You want to go under and then come back out. You don't want to go straight across. You don't want to pull. This is much more anatomically easy. You just turn the wrist.
It's all in the wrist.
Usually bullet wounds or puncture wounds like this, we don't sew up. So because it's a penetrating trauma, you're pushing pathogens deep into the tissue. And so if you do sew it shut, you now are potentially locking in bacteria or viruses or whatever else is out there into the wound. Oh, we have a blister pack here, getting some medications. Majority of the time, it could be related to pain meds, it could be related to antibiotics, it could be related to radiation exposure, because sometimes you need potassium iodine pills. Most common pink medication I've ever seen, Benadryl, diphenhydramine. Then you'd say amoxicillin has a little bit of pink in it, but I think it's like pink and purple or pink and blue. And then Pepto-Bismol is pink. Those are the pink ones that I know of.
It's pink.
No, it's psychedelic, mate.
It's pink.
These pills most commonly look to me like the classic acetaminophen that you would get at the hospital. Bottles of medication are good, just checking to make sure that the medicine hasn't expired. It's what the manufacturer puts on. Typically it's about 2 years. Sometimes when you get your meds from the pharmacist and they put it in a new bottle for you, they shorten that because it's not in its original sealed container. Taking the meds without any liquids.
You ever like try to swallow a really big vitamin with no water?
You can actually get pill esophagitis when the pill actually gets stuck in the esophagus and causes inflammation, potential erosion, and significant amount of discomfort to that tissue. Can cause massive issues. So please don't do that. Make sure you lubricate before, during, and after. Oh, we have an IV kit. This looks like a blood bag. You see the red behind and it's got an IV. So, oh my gosh. So we got good blood vessels to access intravenously, but you can't just stab it that easy. It takes a lot of skill. As an ER doctor, we are not the best at getting IVs. It is the nursing staff that is very good. Putting in an IV, you need to clean the area. You might actually use a tourniquet. At the hospital, you'll see that most IVs are put on a pump, except for like normal saline. Then we just throw that wide open or just trickle it in. But most of the medications and blood need to be going in at a certain rate. Looks like auto-injecting through clothes, which you can do. We say that all the time for people who have anaphylactic reaction requiring the EpiPen or other brand. Gets a knife out, oh, and then splints the arm, which is great. Good job. Again, that's just for either forearm bandaging or for wrist injury. Oh, and the lasso. Let's add another tourniquet to another tourniquet. We're going really proximal with the tourniquets. You don't necessarily have to go that proximal. If the injury or what you're dealing with is below the elbow, you can go just above the elbow. You wouldn't be suturing through your clothes. You'd have to take your shirt off so you can actually see that. Hopefully you would clean the wound, use antiseptic, use anesthesia, and then bandage it up afterwards. It's interesting that they have blood in their pack. So typically blood needs to be kept at a certain temperature. Once it's actually been thawed to room temperature, it has an expiration. Just like, you know, anything else that you would put in room temperature. Just rips out the IV and he's fine. Patients do this all the time. They rip out their IV and now they're just bleeding everywhere. There's a big hole in there. So your body needs time to close it up and you need to put pressure on that area. What kind of food we got? We got food? Oh, we have like an MRE.
Mr. E.
Meals ready to eat. I've never had one actually. What is your favorite one and what is your worst one? All I've heard is that they're gross and they cause constipation. Whoa, cool. Okay, what do we got here? These look like leeches. Leeches are twofold. They're sucking blood out of your body, making you more anemic, but there is a medical component sometimes of leeches where they will use leeches to draw more blood to an area if you need better blood supply to that area. With leeches, we see it in movies, people like burn them off or try to use salt. Don't do that. You can cause injury to yourself. Oh, see, they're everywhere. Sometimes if you try to squeeze them too hard, they can actually regurgitate contents back into your tissue. Could increase the risk of infection. Because remember, they are puncturing your tissue to draw blood out. Our skin has bacteria on it that typically helps protect us when there's no open wound. But once there's an open wound, it increases the risk that we could potentially get skin bacteria into our tissue. What is this?
What are you?
Some sort of worm bug stuck on the skin, causing an injury. Sometimes if you squeeze or try to pull it off, it's not the best thing. A good example would be, say, like a tick. It has almost like a hook that embeds itself into our tissue. If you try to grab or squeeze it too hard, we can rip the hook off so it still stays in your tissue. Using a bone needle. The needle slides underneath it to help to lift this up as like a smooth surface. Actually pretty smart. But now you have to address the wound. Normally, if you didn't have this kit of bandages, you'd probably clean it out with water and then you'd likely put a topical antibiotic ointment on it and wrap the dressing, especially if there's an open wound like the sore that we see. Oh, now this looks like a juicy laceration.
Juicy, juicy.
You can close this up if you have the right equipment to be able to do that. Clean the wound out. Don't know if he has a canteen of water. Does he want to waste the water on his wound? If you do close up a dirty wound, the likelihood of it getting infected is pretty high. You may want to almost close it up as if you know it's going to get infected. At least if it's a little bit of an open edge, it can drain a little bit and you have a chance that it's not going to get infected. Oh, very cool. We're using the ants. So this is actually a technique that you can use in survival medicine. Typically, the ant that would be used is like a weaver ant, but any ant that really has a very strong mandible could be used. So you actually get them to bite down on it, close, and then take off their head. So it is a thing. I think it takes probably a little bit of practice to figure out how to do it. I've never done it before. It would work similar to a staple that I would use at the hospital. But hey, look at that. The wound looks a little bit more closed, not gaping anymore. And you have the ants' heads just sitting there on top of your skin. You probably want to put a dressing over top of this, protect the wound, and try to put something on it to prevent it from getting infected. Oh, that's a big gash on the calf there. Just below the gastrocnemius, over top of the soleus. Again, really difficult to close up. You can use the ant. This one, specifically on an area where it's going to be moving a lot, you need something strong so it doesn't like keep pulling open. Oh, that is a big wound. Oh, that looks infected. You have erythema around the wound, so that's that redness. Sometimes we will start classifying this as an ulcerative wound with cellulitis. The green, gross, yellow stuff on the outside could be one of two things. It could be purulent discharge from an infection, or sometimes when the wound is that big, you're actually having new cells and skin trying to actually form, and that layer could be very fibrous. So sometimes if it wipes away and it looks like pus from like a pimple, it's more of an infection. They're grabbing maggots to actually go into the wound and actually clean the wound. Basically, they're doing medical debridement, so they're eating away the dead tissue instead of like a surgeon cutting it out. This is actually a technique that can be used to clean wounds that are very badly infected. We'll have a patient come in to the emergency department with pretty bad wounds that have maggots already there. The maggots will feed on the dead tissue and the bad tissue, not the good tissue, and then we'll keep it clean. From an infection standpoint, they're actually controlled, so to speak. We are putting on some leaves to the area as a dressing. Sometimes different leaves have different properties, but a lot of times it's also just a barrier to prevent bacteria from getting in. A leaf in general doesn't breathe well, so you'd have to probably change your dressing more frequently than you think because it will keep moisture in and keep the wound a little bit too moist, which then might not allow it to heal. Sometimes you can actually even use like a tobacco leaf because the nicotine that potentially is in them can cause vasoconstriction if there's some bleeding. But the best thing is if you're going out into these environments to have like a field wilderness medicine type book, so that way you can identify plants that might be medicinal versus ones to stay away from. What do you think that was? Oh, he just showered. Oh, that's very funny. Really good. Make sure that you wash off any bad dirt. We'll even do that at the hospital. Sometimes we'll use the alcohol swabs or the alcohol hand sanitizer. That's for non-saturated or soiled hands versus if there's anything on there, you need to truly use soap and water. But remember, a lot of the soaps that we have are antimicrobial, antibacterial, which then are removing your own protective bacteria on your skin as well. A spoiled banana. Usually a spoiled banana is just so like ripe that has actually like alcohol content in it. Not a lot. Oh my gosh! A lot of people that come into contact with me because they have GI symptoms will say they vomited 40 times before coming in. I ask them thereafter, did you continue to drink or eat after? And they say yes.
Yes!
You vomit, your mouth is dry, you want to wash your mouth out, you want fluids, you drink, and then your body's like, no, we're not ready, we're gonna vomit it back up. We want you to do, rinse your mouth out and just take a break, get some sleep, give your body just a little bit of time. Ooh, cool scene. Water. What type of ailments are we seeing there? Don't drink it. Oh my gosh, don't drink it. Drinking fresh water like this increases the risk of different pathogens in there that can cause GI issues. Nausea, vomiting, diarrhea. You're trying to drink water, but you're making the problem worse. When you're in this scenario, you need to either boil the water or you need to have like tablets that you can put in there. Oh, and we got a lot of... This looks like bees.
Bees?
We do have some wounds to the tissue already. In scenarios where you have a lot of bees like this and you're getting a ton of bites, even if you're not allergic, you might have a significant reaction of inflammation, which could cause symptoms of hypotension, tachycardia, lightheaded, dizziness, and actually could cause cardiovascular compromise. Oh! We have a shark bite to your forearm, big sharp teeth that are going to embed into the tissue, causing puncture wound as well as like a ripping injury. We do worry about fractures to the bones. In the emergency department, we'll actually get x-rays. And then what's really interesting, when you have puncture wounds that are pretty big, we don't necessarily close them all the way up because we know they're inoculating bacteria into the tissue. There's a high chance that it'll become infected. I love me some Far Cry. Let me just snap it back in place, no problem. Sometimes it's actually pretty easy to put either a fractured bone back in alignment or a dislocated joint back into place. Just need to have muscle relaxation. Sometimes somebody is super relaxed and is able to get back in with some pain medicine, versus if you're not really relaxed, we'll probably do conscious sedation. Oh, thumb dislocation. Nice. Thumb or finger dislocations are typically one of the easier ones to put back because you can actually anesthetize just the finger. So we'll do a nerve block just to the digit. It's called the digital nerve block. Nice little bandage here. We got like classic bandage. I know in the game Far Cry, some of the bandages aren't just wraps and bandages. They actually have like medication in them. But in general, anytime you have open wounds, it needs to be covered. It would be beneficial if any open wound gets topical antibiotic ointment on it. The ointment also provides a barrier preventing things from getting in, as well as keeping it covered with a wound dressing. Oh, nice. We got an auto injector. We have a couple auto injectors that we use at the hospital. Everybody knows the EpiPen, which go right through the clothes. The point of pushing on it is it auto injects in and gives you that medication that's in there. Sometimes there are Narcan pens. Okay, so naloxone in case somebody overdoses. Ooh. Puncture wound through the hand. What do I always say? Don't pull it out. But in the hand, as long as it's really not in your wrist radial artery or your ulnar artery, you're probably going to be okay, and you have the ability to put enough pressure on it to get the bleeding to stop. That is the increased risk. So the risk is worsening bleeding and potentially causing more trauma or damage as you pull it out. But again, somebody's going to need to pull it out anyway eventually. So if you're found yourself in a situation where it's inhibiting what you're doing to get to safety, then there's always exceptions to the rule. Oh, he bit his own forearm to get what appears to be foreign body, maybe a bullet out of the arm. It is a misnomer that we take bullets out. Now, if the bullet is that superficial that you can pull it out with, say, like your teeth, then we will take it out right then and there, easy. But if it's deep embedded into the tissue, it stays. The only time we really get rid of it is if it's in a joint near your spinal cord or in your brain. The only type of green elixir that we have in the emergency department is actually liquid cocaine. Yes. It's not something that we actually ingest. We use that specifically in the emergency department for nasal bleeds because it's vasoconstriction. So we could put it on a cotton swab and put it in the nose. We don't like too much of it because cocaine could cause tachycardia. So we don't want somebody's heart rate going up or messing with their blood pressure. Oh, cool. We got the prosthesis that is metallic. We're not there yet where we have the prosthesis that can function on its own per se, but we're getting close. As you see, a lot of robotics happening, autonomously doing things on their own. But when it comes to the human body, there needs to be a connection of that arm to the brain to have appropriate function. Oh. I wish I had this type of miraculously healing fluid that I could just pour over my patients' bodies and heal them. So we don't have this. Typically, when we have a bad wound that we wanted to heal, we clean it out really well, and then your body has to heal. We're just doing things to hasten along the process or prevent it from getting worse, but our body's mechanism is to prevent infection in general, so your body will heal yourself. Oh, nice. And again, my favorite, either finger dislocation or fracture. Fractures also need to be put in a line. Sometimes if they're so bad, orthopedic surgeon or a hand surgeon will actually put a pin that looks just like a sewing needle, and they'll put it directly into the bone to make it aligned. But a lot of times these will be coming out of the skin. So you got to be careful and make sure you get them removed in the appropriate time. Removing an arrow out of your arm, there's the potential of it having the barb and getting stuck. If that were to come into the emergency department, which really doesn't happen, we'd have to be careful as we try to reverse that out. Sometimes it's easier to push it all the way through the tissue. We'll have people come in who have gotten tased with the projectile tasers that have barbs, and we have to take those out. We need to pull that out. Sometimes we rip it out. Sometimes we're able to use an 11 blade and cut it. Oh, the noise. Most of the time we don't necessarily hear the crunch when we put it back in, but we do feel it. Usually it's just the ER doctor and maybe the tech that can feel it because we're holding the limb. That is more of a sound of not a joint going back in, but realigning broken bones. The way that it is twisted and bent looks more like a broken bone than it does a dislocation. The ankle is turned in quite a lot. Ankles could be pretty difficult to put in because there's so much muscle attachment and tendon that it's keeping it out. Those will use conscious sedation for, so somebody can not be in agony and relax. Just depends on the direction in which you actually have to pull and turn it. Making sure good pulses after and sensation. Oh, come on.
Come on!
You don't need to just stab yourself in the leg to remove a foreign body. Most of the time, foreign bodies will make themselves out of your body. Your body will reject it. If you can easily grab it, fine, take it out. But you're in the middle of a battle and you're just like stabbing yourself in the leg. You're gonna cause more trauma. You have to be careful. People always want us to get the foreign body out, but not realizing that we can actually cause significantly more damage to the tissue. Ooh, a little emergency kit. First aid kit, I have one at the house if you guys want to see. I used it on the show with Coyote Peterson on Brave Wilderness if you guys want to check that out. I do keep emergency kits around, even in my own car. I have like tourniquets, just you never know. Bandages to the arm and different medications. Just depends what you're using it for, but these are healing. Ooh. That didn't look healthy. That looked more like a burn. Second or third degree burns to the hand, they immediately need to go to a burn center to be evaluated because hands, feet, nose, ears, genitals, and anything circumferential, or depending on your age, depending on the percentage of body surface that's been burned, they need to go to a burn center. Oh, a little canister to inhale. That is super cool. It says gas on it. That is very generic. Could be oxygen.
Could be helium.
Those are the two gases that we use often in the emergency department. Oh, you're on fire. Stop, drop, and roll. Fire! Or smother yourself with like your blanket or pat this out. You do not want your clothes to catch on fire. It's going to make everything worse. Once a burn sets in, the burn has happened. Sometimes people will put antibiotic ointment or Silvadene on an unopened wound. It really won't help. You need to just keep the tissue moisturized in those circumstances. Oh, wow. That was pretty good graphics. Nice. Just pulling through a leather glove and through the soft tissue, the pad of the finger, which can bleed a lot and can actually cause an infection leading to a felon. Treatment of it is sometimes actually putting a device through and through so it allows it to drain out because there are a lot of septated areas to the pad of the finger. But you got a glove on, it's gross. We don't typically cauterize things too often in the emergency department. We like to do direct pressure and then suture things versus burning them. There are times we might use a burning technique. In the operating room, sometimes they will use what's called a Bowie knife, and it actually sends a little like electrical current through it so you can cauterize something. I love that there's so many games that have bandages and healing. If the games are doing it, maybe do it in real life and bandage up those wounds and make sure they're not just dripping everywhere. There's so many times that somebody comes to the emergency department that have wounds that are open and they don't realize that they need to cover it and they're gonna get worse. I took somebody's shoe off the other day and it just smelled of funk. The bacteria was just producing such a bad odor. I love the drama of popping the lid. You're gonna eat all the pills at once or you have to refill it, but these are capsules. That way there's the powder on the inside. Usually breaks down pretty easily in the stomach. This could be pain pills, this could be antibiotics, this could be something for anxiety, could be something for depression. E. coli. We have snacks here. We got the Ego Chaser, E. coli. As long as it's E. coli, not E. coli. E. coli is a bad bacteria that we have naturally in our body, but if it ends up in the wrong spot, it causes issues. It's like the #1 reason why somebody has a urinary tract infection. Not a big fan of sodas. There's a lot of sugar in there.
Sugar.
Deadpool. There's a Deadpool game? Nice. So Deadpool and his sweet healing powers. I've asked before if Deadpool's head was destroyed, that if he could re-heal, and everybody in the comments told me that if any piece is around, it will re-heal. Oh, and of course we got the healing powers of Wolverine. Look at this. Just cleaning up, healing up. Unless he's got that crazy weird bug on the heart that wasn't allowing him to fix himself. But very cool. And that's just why he has the metal in the body, right? He's able to heal himself. I wish I had that healing power. That'd be pretty cool, right? Oh. Oh, no. A wasted med kit. There are times when, you know, in medicine, you're throwing the kitchen sink at somebody. Meaning end of life care, you're doing everything humanly possible. And yes, you take a step back and you can be like, oh, you're wasting blah, 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 blah. It's like, no, I don't care. I'm going to do everything I can possibly to help this individual in this moment. And we will throw the kitchen sink at them because that's what they would want us to do.